Hello, it's Dr. Melissa Ree here, clinical psychologist and senior lecturer at UWA's School for Psychological Science. Thanks for joining me as I talk to you in this Wellbeing Series about sleep and optimising it in the context of the current COVID-19 pandemic. Please do watch the other excellent videos in this series as they link very nicely together to give you some great tips. In my work as a clinical psychologist specialising in sleep, I'm aware that some people are experiencing improved sleep at the moment, whereas others are having a really hard time under the current circumstances. Sleep is often disrupted in times of uncertainty, anxiety and stress, and also in response to changes in routine. And if sleep does worsen, this can cause a lot of worry about getting to sleep the following night. However, when we worry about sleep, this tends to make matters worse. It's a vicious cycle. So one of the take-home messages today is to encourage you to find a balance between being proactive in creating a sensible structure to support your sleep on the one hand, but not becoming overly preoccupied with it on the other, remembering that a few nights of poor sleep aren't going to do you long-term harm. You will recover. But if your sleep is consistently being poor, there are lots of steps that you can take to be proactive in responding to get your sleep back on track. But before we start to talk about putting strategies into place, we need to make sure our expectations about sleep are in order. And there's a couple of key ones that I'll just whiz through with you now. Firstly, remembering what a normal night or healthy night of sleep looks like. We sleep in cycles across the night. We get most of our deep sleep in the first couple of cycles, and the later cycles in the night tend to be full of lighter sleep, and we might be more prone to wakefulness and some disruption. So remembering that waking 2 or 3 or 4 times a night briefly is quite normal and quite healthy. Also, that if you're getting about an hour of deep sleep a night, you're doing well. This is all we need, and we're unlikely to get more. It's also important to think about sleep duration. We'll do away with the myth that everybody needs 8 hours. We know that most people do well on about 7 hours of sleep, and the Sleep Health Foundation has put out recommendations to suggest that anywhere between 5 and 11 hours might be appropriate for a given individual. So you can see there's quite a wide range. So it might be beneficial to question where you fit on this spectrum. Moving now to talk about a framework for thinking about sleep problems. This framework I call the 3 barriers to sleep. And if you understand the 3 factors in this framework, you'll be well placed to help a misbehaving sleep pattern get back on track. The first two factors are biological processes, the body clock or circadian rhythm, and secondly, the sleep drive. We can look after these by having good consistency in our rising time in the morning, good consistency for getting outside during the day and getting some bright light in the morning, and having a wind down before bed. I'm not going to focus too much more on these because these will be covered in one of the other episodes. Where I'm going to focus is on number 3, being wound up. Because even if the circadian rhythm is in sync and our sleep drive is nice and high, if we're wound up, sleep can still be impaired. So being wound up, this refers to feeling on edge, tense, anxious, stressed, or the mind just being busy. And COVID-19 is certainly presenting us with conditions ripe for being wound up. Some of our basic assumptions around control, certainty, and predictability have been called into question. Thankfully, there are a number of strategies that can help us to de-escalate this feeling of being wound up. I'm going to focus on the bottom one here, mindfulness meditation. Mindfulness is a word that we're quite familiar with now. There's still a few myths and misconceptions around what it is. So today I'd like to introduce you to the idea of mindfulness and invite you to consider taking up a practice and seeing after 3 or 4 weeks if you feel it's for you. Research is uncovering that mindfulness is a powerful tool in the quest to treat insomnia and to improve overall well-being. It can result in wonderful improvements in tension, in sleep and mood. I'd like to ask a question of you. At the moment, is your mind more like the thought bubble on the left or the thought bubble on the right? The left represents when we're tangled up in thinking about our to-do list, the future, the past, judging and worrying, or wishing for things to be different. The right represents mindfulness, being focused on and experiencing the present moment and allowing it to be just the way it is. Calmly focusing on the present moment might sound trivial, except for the fact that it can be quite difficult to do. And this is in part because human minds are built to be busy, planning, worrying, problem solving, daydreaming, and generally jumping from one thing to the next. So our aim with mindfulness is quite clear. As a famous mindfulness instructor and researcher, Jon Kabat-Zinn, comments, one way to envisage how mindfulness works is to think of the mind as the surface of the ocean. There are always waves, and sometimes these waves are big and sometimes they're small. And our goal isn't to stop the waves in order to make the surface flat. This would be impossible, but rather to learn to surf. If we can achieve this, we can be the recipients of some terrific benefits. Mindfulness helps us to choose where we place our attention. The mind is no longer being pulled around all over the place. Indeed, brain imaging research shows us that mindfulness practice helps the brain to more truly rest. Mindfulness can also help us listen to our body, becoming aware of when it's ready for sleep. It can reduce physical tension. It can help us to unhook from unhelpful thought patterns that lead to anxiety and sleeplessness. And importantly, mindfulness can help us to get more out of life. When we're mindful, we get our moments worth from life's little pleasures. So I hope you might be convinced to give this a try. Getting going with mindfulness is embarking on a bit of a journey. It doesn't always work immediately. It takes practice. Like learning a musical instrument, we won't fully grasp it without regular practice. The COVID pandemic could be seen as a stimulus for establishing a mindfulness practice. Give it 3 or 4 weeks and test whether it might be for you. It is best done regularly, each day if possible. And during the day, which might sound unusual for sleep, but we find that it's best to build the skill during the day, and then it's ready and it might just work for you when you need it in bed at night. So a couple of suggestions to take away. One I like to think of as waiting for coffee, but it could be waiting for anything. But the idea is to think about the next time you're waiting to pick up your takeaway coffee. Can you put your phone in your pocket and simply wait? Pay attention to what you can hear, what you can see, what you can smell, or your breath. And each time a thought pops into your mind about something else, to just thank the mind. After all, it's doing what it was built for, and coming back to focusing on whatever you're wanting to focus on. That might be the sights, the sounds, the smells around you. And do this repetitively, because the mind will be pulled away onto other thoughts, planning, or daydreams. And your task here is to keep bringing it back to the present moment. And in doing so, you're building the skill of choosing where your attention is focused. You might also like to choose another daily activity where you can be mindful, paying attention to just that one thing while you do it. This might be cleaning your teeth, going for a walk, having a shower, drinking a cup of tea, even sitting at traffic lights. You might also like to supplement these informal forms of mindfulness with a more formalized practice. And this is where you might be sitting or lying down, listening to a guided meditation on a CD, a podcast, or an app. And there are heaps of terrific mindfulness resources out there. And I'll leave some links to some of my favorites in the description for this episode. So summarizing with 2 final points, remembering that an acute spell of disrupted sleep won't do you long-term harm. And secondly, that by being aware of and taking care of your sleep drive body clock and feeling wound up, you'll be well placed to get your sleep back on track. However, if you find that the suggestions here didn't improve your sleep, or you're having lots of trouble implementing them, it might be a good idea to access further support, ideally from a health professional. Thanks a lot for your attention today, and good luck with navigating through the pandemic. I'm wishing you the best. Bye for now.